Hey, thank you, everybody. I apologize I couldn't be at our last one. I heard it went well, and really can't believe that we're already on our fifth one. That this one is mainly in and around the U.S. SHIP program, the Swine Health Improvement Program. And what you'll find is that a lot of the other four that we've talked about to this point will kind of accumulate and condense right into this particular topic. So it kind of is the culminating factor of how the industry is pointing towards as far as how to deal with foreign animal diseases and maintaining trade. But interestingly, also, I mean, there's already been a ton of interest in taking this to another level, to where it would also include domestic diseases, and that could be everything from PRRS to flu to mycoplasma, you name it. It actually is modeled off of the NPIP, which is the National Poultry Improvement Program, which has been around for decades. And that program uh, has been very, very successful. Lots of volunteer. The majority of the herds within the U.S. are parts of that, where they contribute in order to handle some things that are domestic, and potential foreign animal diseases or bird diseases in that case. And so from that standpoint, it's been really successful. It's almost not mandatory. I mean, it's just almost that everyone that's a major player within a commercial herd and or flock ends up contributing to that. And largely, it's really what has kept us going throughout the high pathogenic avian influenza that has been up in this area for several years. Right now, we get a little bit nervous because a lot of bird flocks, the wild birds are migrating, and we tend to see a spike in those during that time. And so, despite having that, we've been able to keep international trade open for our poultry. So, and it's also provided a lot of good resources from a biosecurity standpoint, in order to keep the pathogen from spreading. So anyway, I'm going to do this a little bit different tonight, from the standpoint of once I really was starting to put things together. I realized that really everything that I wanted to cover is really well done on this U.S. U.S. Swine Health Improvement Plan website. So you can see it up there at the top. The link is through the Animal Plant Health Inspection Service, is what APHIS stands for, United States Department of Agriculture. And so this is a really nice website that one, people can work to enroll. Just gives a great broad oversight of everything that the program is about. And so I just thought that I'll try to be careful not to like do mass scrollings and go too fast, but so that everybody doesn't get dizzy in the process. But anyway, this is kind of, you can see like right here on their main page is there's a button here in order to enroll and to certify. So this has been going on now for about 3 years. So you can see there are several tabs here that'll have this homepage. It'll talk about working groups. It'll talk about meetings, information center. We'll go into that here in a little bit, and then how to enroll and certify. So really within the context of what this does is, this is really designed around enhancing biosecurity to a very large degree. There's kind of three big working groups and three big areas that at these get-togethers that happen once a year, where delegates from each state that participates, including Hawaii has the opportunity to send delegates as well, because they have chosen to participate. But anyway, there's three main categories, and those revolve around biosecurity. So obviously, it's really, really key that if we're going to have control over, let's say domestic diseases too, but over foreign animal diseases, we have to have really good biosecurity programs. And those range in what they are. It may just be some physical things that we do. Um, a lot of it has to do with movements of anything into and out of a farm, et cetera. Then obviously being able to trace these problems. It advances traceability. It sets a standard for data reporting and record keeping that help ensure the movement of healthy swine. So very quickly within, and I do this with my domestic diseases right now, is as soon as I have an outbreak, I am very quickly doing back traces to where else could we have spread this to, even prior to the finding out. So there's that kind of pre-patent period where there's virus or there's bacteria or there's other pathogens around, and those pathogens have the opportunity to spread before we actually notice significant clinical signs. So that traceability is a really, really big piece of this program. And then also to improve surveillance, so rather than waiting for clinical signs, having a surveillance program put together, especially, and we'll see that in a little more detail, especially once a case has been defined. So basically kind of levels of that depending on what the severity of everything that's going on. So that leverages the sampling and testing to demonstrate herd health status, support commerce and trade. So if we can prove that, hey, somewhere in a small county in Maine, we have a herd that has this particular disease, that doesn't mean that it's everywhere. And with a surveillance program, we can feel comfortable or to make our export partners comfortable to receive our products. So the threat, and this is a large focus on foreign animal disease again. That's really what started this whole process. Is the threat. African swine fever and classical swine fever are the two biggest targets at this time. And like I said, this will most is expected to branch into many other diseases. I don't have the NPIP, the poultry program, kind of scripted to my mind, but I think there's 5 or 6 different diseases that they monitor there. Some of those being, or a lot of those being domestic diseases. So anyway, these are highly contagious and deadly diseases of both domestic and feral swine. If either virus is detected in the United States, essentially 76 million domestic will be at risk. So, we are a net exporter of pork. That drives our markets to a large degree. Not that we can't consume pork domestically, but getting one of these two diseases certainly impacts even that. So the plan itself is a cooperative plan between state authorities, federal authorities, the industry itself, and it's designed to improve the health and marketability of the swine herds and pork products. So participants in this national pilot program can apply for disease-specific certifications recognized across participating states. And then the benefits from this are multiple. One, it creates a national platform for standards. Again, that not just a platform that's going to be focused on those two diseases, which is just the start of it. But like I said already, there's many, many plans to incorporate domestic diseases. There's a couple different agencies that do some tracking, especially of PRRS and the enteric coronaviruses within the U.S. One is based out of the University of Minnesota. One is based out of Iowa State University, and both of those programs have a little bit different spin on how they gather data. And I certainly know that those two organizations are very heavily involved in this U.S. SHIP program and getting it off the ground and going. And so it'll be a quick and not easy, nothing's ever easy, but it'll be a fairly rapid ability to be able to incorporate in a lot of surveillance, not because it's surveillance through the program, but for the vast number of cases that come into those two places and or are reported voluntarily to them, to be able to incorporate a lot of information really, really quick. So then the second benefit of this is it issues a certification for ASF and CSF monitored status. Thirdly, it identifies and adopts biosecurity best practices, as those are defined by industry experts to improve swine health. And so, certainly, what's really nice there is that it's not just a closed door kind of situation. And we'll go into a little bit later is that there are delegates, and those delegates aren't the same people all the time. I've been a delegate before for Nebraska. I've been a delegate before for Kansas, and then there's been times that I haven't been a delegate at all. So the nice thing is there's a revolving situation. Certainly, sometimes you see the same faces that are kind of the core of it, but then we get opportunities to bring in new ideas. And then fourthly, it's designed to increase domestic and international trade partner confidence in the U.S. Swine and pork products. So this has been pushed really well and hard through U.S. Ship and meeting out partners, and now with the pilot program sponsored by APHIS, with the support of state and industry partners. The endorsements come from the United States Animal Health Association, American Association of Veterinary Lab Diagnosticians, obviously the National Pork Board, who's sponsoring this whole thing that we are doing now and we'll be doing live. The National Pork Producers Council. So really two different entities with kind of the same goals, but truthfully have different roles. And then overall the Meat Institute. And so then that really kind of gives just a general background of what we're trying to accomplish with US Ship. And then there's several tabs here that talk about what your role is. And we don't need to go through all those, but basically they view it from several different phases of the industry. Obviously, those that are participating, and that's all phases. That's small producers, large commercial producers, show big operations, marketers, packing facilities, etc., are all open and get their voice heard, especially within these working groups. They're very careful. Like I said, there's a biosecurity working group that I spend a lot of time with, traceability, and then the sampling and testing. And those are very broad in the type of people that are involved. And so one thing that'll be, as you all find interest in this, the delegates meet usually every September. It is in Minnesota. Only good news is that Minnesota is not frozen over yet in September. It's a beautiful place. I think the last several years they put it in Bloomington, which is kind of in that St. Paul, Minneapolis area. And anyway, if it's something that's going to interest you and you want to make sure that your voice is available and heard in those settings, because again, it's a voluntary program, but we also want to make a program which is beneficial and useful and practical to all phases of the industry. Are we going to always make a perfect widget that fits every scenario? No, but we have to make sure that we're trying to be as inclusive as we possibly can. And then they also go through different roles for whether you're official state agency, whether you're a program administrator, whether you are one of the delegates. So like it says here, the House of Delegates votes on U.S. Ship program requirements. So your resolutions are broad. It's very almost, I don't know if whatever order rules for these meetings is, but it's basically run in a very civilized manner. But what's really cool, it kind of gets you back to feeling, you actually get to hold up a card that says yes, my vote's yes, and obviously majority rules. The House of Delegates is made up of U.S. Ship participants, so people that are enrolled in it, producers that determine that they want to be enrolled in the program. And then these delegates are appointed by their state's pork producer association and their U.S. Ship OSA, which is our state office people. So like I said, if you want to be involved in that, there's people on this call. There's people within the industry that I'm sure you all can get a hold of. Because if you want to have a voice in that, and have the opportunity to be a delegate one of these times, then just make sure that you let them know. The House of Delegates also includes the actual state animal health official or their designee from each participating state. So that's who's voting on it. It's not the Packers that are voting on it, unless they're a particular participant in it. But basically it's around the participants and it's around the state of health officials because they're the ones that are going to be the most detailed and bogged down with the details when it comes to protecting state livestock. And then number five, we do have these working groups, and the working groups explore potential program advancements. What do we need to incorporate, taking information or comments that come from the delegates and from industry to say, hey, we need to tweak this. We've done a couple pilot programs that to see if things are feasible or not, that different volunteers have agreed to do, and then to report back on. So it's a very organized process that we really feel we're making progress on. And then the veterinary experts, veterinarians are highly involved. APHIS has great veterinarians. They review the proposals after the House of Delegates meeting. They assess them for incorporation into the program requirements. And then APHIS provides support to the state animal health officials, the working groups, and the House of Delegates. So very collaborative effort. So lots of information there. That's just the homepage. There is this tab here, which is about working groups. And those working groups, like I said, there's one for biosecurity, there's one for traceability, one for sampling and testing, to make things as simple but effective as possible. And you can go to this and you can look that up and go through those. Meetings. The House of Delegates meeting like I said, was held last in September 2025 in Bloomington, Minnesota. You can go here and you can see all the proposed resolutions and standards. You can see all of the U.S. ship proceedings, and you see the updated program standards and meetings and minutes. So just like any type of delegation, you have lots of different voices that from the industry. And even within, I'm sure, your own state or even your own neighborhoods, there's lots of opinions. And so almost certainly I can tell you that when I've attended, I haven't agreed with everything that happens. Don't expect that I'll always agree with everything that happens. But feel very good that I've had the ability to measure my voice out and be listened to, and then allow to give my ability to influence decisions as they move forward. And any resolution that's made, just like anything else, can be reversed and or adopted or changed. Biggest thing that I can tell you is that if you're concerned about anything within this program, get involved. On the far right is enroll and certify, but what I want to go to here is the information center. So within this information center, again, a whole nother separate set of tabs and different things to look at. There's actually a program timeline that'll take you back through like when this all started, kind of the timeline they set in order to get what they call codified within the governmental agency as a program. Again, that codification does not, and it's the same way for the decades old poultry program, does not make it a mandatory program. But basically, it is still a voluntary program, but it has very defined guidelines to be participating in it. There's also a U.S. Ship quarterly newsletter that you can read back through those at your pleasure if you would like to do that to bring yourself up more to speed. Then within the resources, there's resources for the official state agencies. There's resources for participants. There's an outreach toolkit, pilot program standards, different reports that have come out of this, and then obviously the resolutions themselves. So as you can see, it's a pretty busy site once it all unfolds. And so the one that I want to focus a little bit on here yet today, in order to bring you all up to speed on different things, is the pilot program standards. And again, remember that is it's called a pilot program. And as you all are aware of, that doesn't mean it's the final codified program. It's just the one they're working on to put in place for feasibility and to get this thing off the ground and running. All right. let me clean this up a little bit. Okay, so on the first page is just kind of an introductory again, the U.S. Swine Health Improvement Plan. It really shows kind of the revolving circle of how these things they're living documents. Now, it doesn't mean they change every day. They have to go to the House of Delegates once a year, and probably good that way, so that things can be really looked at, and we're not in a constant changing environment that we can't assess and discuss and facilitate. So as you can see, it's a revolving door of the arrows of inform, leading to facilitation, leading to administering the program, leading to implementing it, and then getting new information in. So just like any good implementation program, it works off of feedback and new ideas. Certainly, we never get these things right the first time. But again, I think you've probably heard me say in the past, I'm not going to let progress get in the way of perfection. It will live and it will grow and become something that we're all really proud of. So it really involves four areas again: the producers and packers, then the Congress of Industry Stakeholders and subject matter experts. That comes from a really wide range, from lay people that don't have lots of fancy degrees to people that do have fancy degrees and those in between. So it's a really nice mix. And as you can see here, it says define and continually update the program. So new diseases will come along, old diseases will go, eradication wise. One thing that was just reported on one of the Iowa State programs is we're now 3 entire years that we don't have any reported cases of TGE on the mainland up here. I'm not sure if that includes the Hawaii data or not, but TGE used to be one of our biggest scourges. And so, for a lot of different reasons, that's a disease that, to some degree, there's some people saying, well, should we declare this thing eradicated? And so at least those discussions are being had. But anyway, diseases will come and diseases will go, and then those diseases like PRRS that like to just stay and stay and stay for the last 25 years. And making very little progress on that in the big picture will continue to be ones that we focus on too. The USDA Veterinary Services Program facilitates the program and maintains the program documents, their official holding agency of it all. So we really get into again, this industry, state, and federal partnership. And then really keep in mind again on the pilot, and certainly what will happen as we truly lead into this as a codified program will be biosecurity. It's about traceability, and it's about disease surveillance. Okay. And so again, a reminder of all this is over the last these 5 sessions, we've thrown a lot of things at you guys. All of them 100% being voluntary. And then certainly what I could see is that we'll probably get some people that maybe, I don't know, hopefully not, but some people that will say, I'm not interested in any of it. We'll get some people that want to be a part and just go all in and want to be involved even in the U.S. ship House of Delegates. And then we'll get a hybrid in between. And part of that will come from the summary of program standards. And so remember, just like I told you, is there's certain things that are agreed with. There's certain things that we don't always get our way. I don't care how deep into an organization we get, whether that's religion, politics, or otherwise. There's always some disagreement, but then we have to move forward with a plan. So moving forward on this is kind of where the program standards are for the pilot program. It's a summary below. First category would be enrollment and the participating premises that are to be enrolled with the U.S. SHIP program in the state in which the premise is located. So that's in each state that wants to, and there's actually some states, all of them that are not participating are very scant in their number of pigs that they have. And that doesn't mean that we want it that way. We want everybody to participate and have a voice, because even a case in, let's say, Nevada, or a case in New Mexico, where we don't have a lot of activity of pigs, it's still going to matter in the long run, and those affect us if those get diagnosed. So we're really continuing to push enrollment, and that includes the state animal health officials getting on board and wanting to execute the program. There's veterinary service provider. Producers are to maintain a valid veterinary client-patient relationship with a licensed and federally accredited veterinarian. So that is just one sentence, but there's a lot in that sentence. So one of the requirements, and I certainly don't see this one going away, and this can be a challenge, obviously in Hawaii. It's not like it has a great plethora of livestock veterinarians. And so breaking this down, it's the producers are to maintain a valid veterinary client-patient relationship. So that if you've ever taken PQA, the Pork Quality Assurance Program, veterinary client-patient relationship is very well defined. And what that is that a producer agrees that a veterinarian and the veterinarian agrees to take on the responsibility for the health program for that particular producer and its pigs and or cattle and or sheep and goats and or whatever that are being raised for food. So the veterinarian takes the responsibility onto their shoulders and says, "I will help to make the health decisions that fit this farm in working with the producer." The producer agrees to follow those recommendations that are made. But then the veterinarian has a second piece of this is that they need to be available for follow-up. And what the veterinary client patient relationship does is there's some rules and true governmental laws behind it, is that in order to get prescription products, in order to do certain regulatory things, and so forth, then you have to have that veterinary client patient relationship so that you can get a prescription for those prescription products, whether that's feed products, whether that's injectables or things in the water. So that's kind of outside of this program, but they want to make sure that that is in place so that people have good health programs that are in place. So that veterinarian obviously has to be licensed in that state, but then they also have to be federally accredited. And so that there, you might be surprised. You say, well, why wouldn't all veterinarians be federally accredited? Well, it really depends, and virtually all of them are, but there's really two levels of that. There's a level one, which is more for companion animals. So that really, for the most part, is a little bit less intense. Well, I shouldn't say that. It's just differently focused. So those federally accredited veterinarians, number one, that way, as a veterinarian, they can prescribe. But then the federal accreditation, what that allows you to do is to do regulatory work as a representative of the government. And so, for an example of that, is I have a livestock market up here that I service. That livestock market has me go through and do inspections. And just like with what we're talking about, I'm doing inspections to make sure that there's no evidence of what a foreign animal disease might be. Because if it's there, there's a large accumulation of animals. A lot of animals come in, and the same day, a lot of animals go out. So if there's a foreign animal disease or other serious disease domestically going on there, I need to identify that on my inspection. That's my responsibility. They pay me to do that and to make sure that I put a stop. Fortunately, I've never had to stop a sale. I've had to ask a few questions. Right now, we're dealing with highly pathogenic avian influenza, the strain that got into dairy cattle, and so I have some regulations there that I have to make sure that everybody's following. That allows me to write health papers across state lines. That allows me to do testing for eradicable diseases. You're probably all familiar with pseudorabies. You're probably all familiar with brucellosis. Also within cattle, there's tuberculosis. And so that allows me, with some special training outside of my normal veterinary stuff that I do, to be able to carry out those functions. And so for livestock, you have to have a level 2 one, because there's just some other additional things outside of what the small animal companion animal crowd has to deal with. We all have to deal with rabies. That being a big one in the state of Hawaii. The state of Hawaii does not have rabies, and man, it is a whole list of things you have to do to get your animal in there. So, as probably some of you are aware. So this is a really important step in this, is making sure we have that, and that's something we have to continue to build into Hawaii to make sure that we have the ability to keep that all together and make sure that we have good health within our herds. The next step of this that they're outlining here is the traceability. We have That's why, going back, why we have to premise. We To trace something, I have to know, I have to have an identification of that animal and what premise it's from, or what premises it's been to. And so that whole traceability piece of being able, with AgView or whatever, to be able to show my movements of animals. I certainly can't trace if I don't have a way to identify, and I can't trace if I don't have something logged. So if it's as simple as what we do with people. We're pretty much, by being on any kind of electronic platform, we're being traced, I guess, in that sense. But then we also have ways that we are identified, and most one we're probably most familiar with, whether if it's not a passport, or if it's not a driver's license, or just a state ID, it's our social security number. So there's trackings that are based on that. It really comes down to the pig level too. You're giving them, each pig, kind of its own unique ID, that will allow you to trace it. Now, some of it we do on a herd basis, like for animals that are just going for feeding across state lines. I did a health certificate today. Some cattle, some steers that are going from Nebraska moving into South Dakota. I do a health certificate. And they actually don't require ID because they're castrated. They know they're not going to be a breeding animal. They still need to know that animal's coming to the state and that they can follow up on it. But we're in that case, the only thing we're really required to do for identification is any kind of dairy animal in cattle, and then also intact females and males, basically cows that haven't been spayed and bulls that haven't been castrated that are over 18 months of age. So this traceability is really important. Like I said, we talked about this early on, was the premise ID number. And that's why we talked about that first. If we don't have that, you can't participate here because we don't have a way to do traceability. They like to know the premise type, and it may be an all-in everything, farrow to feeder finish, including boars and everything. Or it may be just, hey, this is where we collect boars only. And this is going to be important information for them to understand in the event that there's an outbreak, so that they know, oh my God, we need to know that you have boars on your site. Are you selling semen going to other places? So it doesn't mean you can't ship it. It just means that they want to keep their hands on it to make sure that we don't infect other herds. Site location, street addresses, latitude, longitude. Again, traceability can't really be done that way. Some people aren't comfortable with giving that information. And again, that's why it's a voluntary program. Date of the last usage of the site by swine owner, if that's applicable. Could be a vacant site, could be a situation where it's an all-in, all-out run site. And so knowing when and where when the animals have been there and when they have not is important. Site owner contact information, just basic stuff, common name and site, expected site capacity, and the date of the initial enrollment of the site in US SHIP. So all traceability things that are really important. And then going to the swine movement information, we won't go into a high amount of detail with that. If you were in on the AgView call, you kind of know what's needed. Basically, where are they starting? How many of them are going? What are they? And where are they going to? Is really what's important there. And then again, back to the semen movement, kind of the same thing. Stud premises participants are to maintain records of where they're shipping semen to. So the participants must demonstrate a competency within 30 days of enrolling in the program to say, yep, I can do this, I can do it proficiently. Because if ever it becomes a problem with where we have to start regulating movements of semen in animals, we have to, it can't be something we're learning at that time. It has to be something that we're ready to roll. And legitimately, those that are involved in these programs, in the situation that something happens like that, from the standpoint of a foreign animal disease, or maybe it's a domestic disease that gets to the islands. Those that have their information in line are going to be able to have the quickest turnaround and freedom to continue to move animals like they normally would. Um, and then obviously, again, animal identification. The certified ASF, CSF monitored participants must comply with existing state and federal laws. So already your state has laws. If I want to ship an animal to Hawaii, I have to look up Hawaii standards. If Hawaii wants to ship something to Nebraska, they have to look up Nebraska standards. And sometimes you have to worry about the standards in between. Not as much, but certainly something we have to do. I have some animals going to Wisconsin. They actually require that we test for PRRS. Most states do not require that we test for PRRS. And in Wisconsin, they won't turn the animals down if you have PRRS, but what they want to know is they want to know that you have a program for that. So it kind of just all falls hand in hand with that. So pretty straightforward on the traceability. The program standard for this pilot program standard for biosecurity is there's been a lot of discussion, and actually we have these working groups. The working group for biosecurity actually breaks off into several other working groups. One of the big ones is the feed one. So there's just a lot around feed, and especially where corn and those types of things are transported a lot of places. We have to be careful of animal byproducts that are used in that, whether that's plasma, whether that's bone meal, fat. You'll see intestinal peptide products that are used for different things. And that flat out also applies for if we're using waste from or recycling, I guess what I would call it, food products back to pigs that came from restaurants, that came from uh, grocery stores, whatnot, school, throwaway or whatever, is we have to be cognizant that a lot of diseases are carried in meat. And so if we're feeding meat back, that becomes a big problem with enrollment in this program. But especially things change for the participants in the event that there is an African swine fever incident that happens. So this temporary cessation, what they're basically the resolution is that in the event that an ASF or CSF incursion into the U.S. happens, they want all products of porcine origin of a participant. So if you're participating in this program and you have meat and bone meal that is from pigs in your diets, then you have to stop that as a participant of the program, or you can't be part of the program. The temporary cessation will be lifted if the ingredients described above are sourced from, and then they list suppliers with enhanced processing biosafety measures, states or regions of which are not at a high risk of ASF, hence they don't have any ASF. And then there's various requirements that have to do with that as far as how they handle it in order to make it safe. Feed supply, yeah, this is the one that touches a lot of people, not just in Hawaii. In a lot of states, is the feeding of swill, garbage, or table waste that has the potential to include meat products is strictly prohibited. I do have some producers in Hawaii that they feed, I guess you could call it swill, garbage, or table waste, but they only feed back vegetarian type of food. So they will not get from sources that have meat, and that's their personal choice. They find different ways in which to get the pig's protein. They want their pigs to be vegan, and find ways to be able to raise them that way. So they will be allowed to be able to, if this pilot program becomes the main program, they will be allowed to do that. Personnel permission individuals have recently been exposed to livestock, feral swine, slaughter facilities in ASF regions. And you see here they even include FMD, foot and mouth disease. Abroad should only visit farms or slaughter facilities after a 5-day downtime. So from that standpoint, sometimes I get some international travel, going to conferences to Europe, and some of those countries are ASF positive, CSF positive or FMD positive. If I'm a participant in the program, um, then and or if a producer is or whatnot, what they're agreeing is if they go to those countries that they'll follow certain biosecurity protocols, and then when they come back, they will stay away from pigs for 5 days. If you remember, we had some discussion. It's a very hardy virus. It likes to linger, and has been found in bone marrow of dead wild pigs for up to a year. So it's on the high end. Do I personally, again, this is kind of like a personal thing, where I don't always get my way. I wouldn't have it at 5 days. I might have it at 3 days or maybe 48 hours. But again, I know at least safely, if they're going above and beyond what I would even do, then that's I'm not going to let progress get in the way of perfection, or perfection get in the way of progress. And then you have to have a secure pork supply site plan. Again, remember we talked about the secure pork supply, so premise IDs, AgView, secure pork supply plans. These all are fit in and tie into being able to be part of U.S. SHIP. And then the last section here is they've kind of created the pilot. This isn't official because remember, we are not allowed currently to just randomly, I can't just say, I can't send tissues into the lab today and say, hey, I want you to run African swine fever. And it's just not allowed. And so we'll see what that surveillance program looks like when it's finally launched. The one thing that we do get on a regular basis is there's a pilot program through the USDA that is paid for by the USDA. It doesn't cost the producer anything. But if a case is sent in that resembles something that could be ASF, CSF, then they will, and tonsil was submitted, then they will run that sample tonsil just to be sure, as kind of a first phase of surveillance that we have. So from that standpoint, anytime I submit tissues, especially with something that could be ASF, granted, it probably isn't. It's probably PERS, it's probably E. coli, it's probably all those things that, remember, we talked about before. It looks like ASF or can resemble it. I'll send tonsil in just as a backup, just to be sure. So the program is based on targeted testing of animals of poor or substandard health. So kind of put your eggs in that basket. Say, okay, if I want to find somebody with SARS-CoV-2 or COVID, and I walk into a room of 100 people and I only get to sample 5 of them, I'm gonna hedge my bets and look for people that are really worn out. They're tired. They say they don't feel good. All that. So I'm gonna skew my collection and my surveillance largely towards animals that are sick. There's some that say it should be towards animals that are dead, because certainly it's easy to get samples from and non-invasively on a dead animal rather than from just a substandard animal. So they're going to target those samples to try to raise our chances of finding and detecting at a low sample volume. They're trying to make these programs by which they're effective, yet they're not overwhelming. And that kind of comes back in again. Let's roll in that other thing we talked about, the certified samplers, is that, man, if this happens, there's going to be a great demand. And so now, if they're telling me I'm going to be in an ASF situation where I'm collecting at one of my clients, now what they're telling me is if I go in there and I collect, then as I come out of that zone, I can't go to see any of my other clients for 5 days. So that doesn't work very good economics wise. And that's why we will absolutely need the enrollment of certified swine samplers. So if you're one of those people out there that really enjoys that kind of thing, most people, most farms I go to, somebody's always wanting to know how, hey, can you teach me how to bleed pigs, or can you teach me how or why you're doing that with your diagnostics? So I think you'll find people that are definitely interested in doing it. The frequency of on-site sampling is a function of time and is independent of the timing of pig movement, thereby providing for a uniform and continuous system of disease monitoring. So there will be a program that gets put together, and it's going to have different levels. So when we're at level one, in which in the US is negative, you can see no additional sampling is currently required. What that I think we will get to that stage, but we're still in that period where we're working with USDA. It has to be a test that the USDA will accept. So I know more recently, we're working with oral fluid sampling, saliva sampling from ropes. It's not an approved one, but people are doing studies on that that have the ability to test ASF to see if, because it's such a simple sample, it just has to meet the USDA's requirements. So really, like I said, level one, really don't worry about it too much because there's not going to be a whole lot to do. But we want to be ready if we would go to level two. And what that would mean is that the US is positive, operations are getting better and normalizing, and the state or region is negative that you're in. So all US ship testing is outside of control areas. So if you're in an affected bubble where you're basically have to get permitting and all that type of thing to get pigs moved and get those permissions, then you won't be at level two. You will be at level three because that means you're immediately in the area or you're one of the positive herds. So at level two, they start to say that hey, if then if the U.S. has a case, we want to be able to show regional freedom of disease so we can continue exports and continue a domestic movement of pork. So within a boar stud, they'll be testing twice a month. You can see it'll be 10 individual samples. They'll pool those. So and then you can go on, and we don't need to go through this for the sake of time. But this will be something that we'll discuss more in detail when we come this spring to do our on-site visits. Then we'll be teaching these different types of samplings: oral swabs, blood swabs, oral fluids, etc., to those that are interested in doing the certified swine sampling program. So you can see here, you get 2 times per month for boar studs. Breeding herds will be monthly, growing pigs will be monthly. Monthly on small holdings, which is pigs of 100 or greater than or equal to 100, but less than 1,000. And then non-commercial, which is really, really small herds, which are a few of my clients. And then they'll only be quarterly. Then it ramps up though. If you are in the level three area, then all of a sudden you're testing weekly on your boar studs. Obviously, if you know it's good, they might be get lucky. I mean, if the boar stud, I mean, it would take a lot of guts to say, hey, I'm going to continue to buy semen from that boar stud that is in an ASF infected area. Obviously, if the boar stud's infected, those pigs are being indemnified and gotten rid of and repopulated. But that would take a lot of guts to want pigs from the boar stud. But they recognize that in certain situations, people may not have any other choice. It's not like we have twice as many boar studs as we need because it's an economics. People want to make money and they don't build any more than they have to. And then breeding herds will go to 2x per month and then monthly on everything else. So kind of different, call them green level, orange level, red level, or whatever that might be. But I just wanted to be able to show this to you as an example so that you guys understood kind of where the US SHIP program is going. So again, you can access that very simply on the US SHIP site and be able to do what you want to do with that. So lots of good information there, and I highly recommend go to the different sites, whether it's a state animal health official site, something with Hawaii Extension, uh, go to the U.S. ship site, AgView, um, the secure pork supply. Lots of good information there. Probably not something you're going to on one afternoon and get through, but it'll help prepare you if you're one of those that wants to be a part of this program. And that's what I have.
Thank you, Dr. P. So we do have a couple of questions in the chat or in the Q&A. Actually, it says in Canada, we decided swine TB was not that important and only Russia restricted import. So what does USA do?
So currently, we do not do any testing for TB unless it's required by a country. And so the only one that I have been involved with is exporting pigs to China. They do require a test in pigs. The by far the vast majority of our TB testing is in cattle breed, whether they're domestic breeds or exotic. In fact, I get the luxury next Tuesday, I'll be doing brucellosis and TB testing on a wildebeest that's going to be going from Nebraska to Texas. Nice is she's nice and tame. So might be the only tame wildebeest I've ever been around. But so that's really, yeah, good question, Joe. Yeah, so we don't do a lot. Unless it's cattle.
He had one more question in there. The USDA figures most wean 12 pigs per litter. California and Hawaii is 5. What diseases do California and Hawaii have that the other 48 states do not?
Probably not anything. I mean, if anything, it seems like Hawaii has some diseases they don't have. I do know Hawaii has a lot of the same diseases as we have up here. It has coronaviruses, it has PRRS. I think, and I can't speak for California as much, Joe, but from what I've seen in Hawaii, some of it's genetics. That why we don't see the total born what we're seeing up here. Some people have continued to incorporate, if anything, we have a lot more kind of hybrid pigs. And even some of those have, I hate to say it, but they have a little bit of wild looky pig to them. I just call it Polynesian. And so what we tend to see is those pigs don't tend to be quite as productive. We also don't have quite the benefits, if you want to call them that, of the same feedstuffs that we have up here. Climate is a tough one in Hawaii. Always night pretty warm, and so we lose some things there. And then what I've also seen is it kind of goes back to why it's so critical that we build the veterinary infrastructure in Hawaii to build competency and willingness because at times I don't think we're getting quite the attention that we do up here. I know when I come to Hawaii, is in Hawaii, so but it's like it's nonstop. It's start to finish. The time I get off the plane to the time we get back on, that we're trying to make things better and help people understand whether they have swine dysentery, whether they have PRRS, whether they have lepto. Going back to that, Joe, I wouldn't say we don't have lepto and we don't have swine dysentery on the mainland, but we have a lot more of it in Hawaii than what we have up here. And so, really putting those efforts towards having the resources to be able to have good approaches to eradication and or high stability. It's also educational to make sure that what I see in Hawaii, I actually saw that more in American Samoa is more indiscriminate movement of pigs and when we don't really know our disease status. And so very quickly we might have the same diseases, but they spread a lot more because we're not testing. So like when I went to American Samoa, the community college, one of the services that they had for people that were for pig producers is they had boars for rent. So they would rent boars and rent them out. But nobody really knew what the status of those boars was, what diseases they might have. And then even if you had a clean boar, now all of a sudden I'm taking that to a customer that I don't have any idea what their health status. Do they have lice? Do they have mange? Do they have lepto? Do they have whatever? The only case of lepto I've ever diagnosed was from a wild pig in American Samoa. So from that standpoint, I really think the big difference that we've have, and that's why this program will allow us to at least continue to build on a culture that we've started with some past projects on biosecurity. But really, it takes a willingness of producers to want to do things right. And then if we can get more herds disease free, we can see that total born move drastically up from five to 12.
I think I don't see any other questions. So if not, I guess any of the other project team members here have anything else they want to add, Dr. Say or Yoon?
Well, I really want to appreciate all of you that attended all of these webinars. I think it's been really good. We learned a lot, and we're really excited to start doing the in-person workshops. I think that was just a starting point for some of us, and then we're really reinforce that all this knowledge and put it in practice in the in-person. So we're very excited to get all this together and meet in person.